Sweet. Well, thank you everyone for coming to the podcast. This is My Understanding. Today we've got Megan Lovesee here. She is a good friend of mine, and she's also been a nurse for 15 years. Today we're going to be going over diabetes and continuous glucose monitors. So, Megan, I know that you've been doing this for a long time, and that you've recently started a business, Sugarwise Nursing, and you've taken a huge heart into diabetes and helping people get in acquisition of continuous glucose monitors.
Mm-hmm.
So how did you get into this business and find out, and how did this become your passion?
Yeah, well, I'm so happy to be here and thank you so much for the invite. It's a pleasure. Let's see, it's been about 5 years now or longer that I've really been kind of studying diabetes and gaining more understanding about how to use the technology that's available to people, particularly with type 1 diabetes.
Okay.
But my passion really comes from the fact that I'm a high risk for diabetes myself. It runs in my family. I have my grandma on my mom's side, my dad, and my aunt on my dad's side are all type 2 diabetics.
Gotcha.
And it's definitely and there's a need for education out there. That's something that I have come to find over the last 6 months in my research, trying to get my business up and going.
Yeah.
And community is key. So right now, 1 in 3 people have diabetes. Pretty high stats.
Yeah, I would agree. I'll be honest, I didn't realize that the number was quite that high.
Yeah, it really is. And shocking, right? To know that in a group of 3 people, at least one of them could have diabetes and maybe just isn't talking about it.
Yeah.
In the media just the last couple weeks, I've heard a lot about this Barbie that was released that has a little CGM and an insulin pump. And they're promoting the idea of more and more people having type 1 diabetes and almost normalizing that. And I think that's such a great initiative that Barbie came up with, because there is a major stigma around diabetes and just such a misunderstanding of the information altogether.
Yeah. That is wild that Barbie did that. That honestly, I did not hear that until you just now told me. That's incredible.
You're gonna have to check it out. I am so impressed with them. That's the one thing that I have come to learn in the last 5 years is the parents and the kids that are really dealing with type 1 diabetes on a day in and day out.
Yeah.
Sugarwise Nursing is for them. I created it because I saw how much time and effort goes into managing blood sugar.
Mm-hmm.
And I had no idea what was involved in it until I soon became responsible for taking care of them while they were at school and their parents were at home. So very quickly, I had to learn that technology. Gotcha. It wasn't until recently that I realized that same technology could be used in managing type 2 diabetes. And that's where Sugarwise was created, for people that are diagnosed with prediabetes and type 2, and offering them that extra support that they're not getting at their doctor's offices.
Okay. Oh, and one thing I think I would love to just make clear, just for the audience, is would you be able to just clarify for everyone just a little bit about like the difference between the type 1 and type 2 diabetes?
Sure. Yeah, Jack, I think that's a great question and a common misunderstanding. So type 1 diabetes is an autoimmune disease. Basically what happens is the immune system attacks the pancreas and destroys the beta cells, which produce the insulin. Okay. And so as a type 1 diabetic, you're no longer producing any more of your own insulin. Whereas in type 2, it's a little different, similar in some ways, but the major difference I would say is that with type 2, it's not something where your body attacked itself. Unfortunately, type 2 is high risk because of family history, like I mentioned in myself, your environment, the way you're eating, your lifestyle, things of that nature. But when I say that, it's not to make anyone feel bad for the way they've been living. Mm-hmm. A lot of the time, we're just doing the best we can to get by, and then these health issues just kind of result. And so type 2 is over time, you become less, you become more resistant to the insulin that your body is making.
Okay.
And so your body ends up having to make more and more insulin to try and keep up with the demands of what you're eating and managing your blood sugar. So that, because your blood sugar stays elevated on a very high level, and so your body has to keep producing more and more insulin in order
to kind of help bring it down.
Correct.
Okay.
Correct. Yeah.
Gotcha. So it's like kind of like more of like type 1 is something that just happens to you. It's more of that autoimmune, like you were saying, just a lack in your body's function. Type 2 is much more of like life choices kind of thing.
Yeah.
Over time.
Yeah. Type 1, you know, really they're completely reliant on medication management. Whereas type 2, it's a combination of medication and lifestyle, with the goal that if you make those changes in your life, better eating habits, more exercise, then it can help reduce the amount of medication that you're having to take.
Okay.
Yeah.
Very cool. Well, I appreciate that insight. So then, as like a little follow-up, so for people who might not be familiar, what exactly is like a continuous glucose monitor? And we can kind of refer to them as CGMs throughout the rest of this, but what is one of those? And then how does it work compared to like a traditional finger prick?
Yeah, great question. Okay, so for those of you who are familiar with what a finger prick is, essentially, you know, you're poking your finger with a little lancet device and you get a sample of blood, and that's taken up through the glucometer, and it gives you a reading of what your blood sugar is within your bloodstream. A CGM is a continuous glucose monitor. So whereas a glucometer only can measure a snapshot in time, so it takes a picture of whatever your blood sugar is at that very moment. Compare that to a continuous glucose monitor where you're looking at something as if it's a movie. It's 24/7.
Yeah.
The information, the data doesn't stop. The difference is that the CGM collects the blood glucose in a different area of your body. It's not collecting it from the bloodstream. It's connecting it from the interstitial fluid. So if we were to look at like a diagram, the way I would describe it is you have your skin and then your interstitial fluid with the cells in between, and then your bloodstream underneath that. The interstitial fluid is the area around the cells right before the glucose is taken up for energy. So it's not going to be the same number. Your glucose is not going to be the same number when you finger prick and when you're looking at your reading on your CGM. There's times where it will be stable and should be very close in range, but it is measuring two different areas.
Gotcha. So it's kind of, so then, okay, so with the two different areas, if I'm correct, what you're saying is there's going to be a little bit like almost a delay then.
Correct. There will definitely be a lag time. If you're looking for an immediate capture, you know, this moment in time, a finger stick for sure is going to give you that piece of information that you're looking for. Maybe you're a type 1 diabetic and you're feeling weak and tired and shaky, which are signs of hypoglycemia. Yeah. And let's say your CGM is saying that you're 120. Well, that is a blood sugar that doesn't represent signs of hypoglycemia. So when in doubt, I always tell patients, if that's what you're experiencing, check with a finger stick.
Gotcha. Interesting. Okay. Sorry, let me see how I want to phrase this. So then I think what you were bringing up is because you were bringing up hypoglycemia and hyperglycemia. And the difference, again, just for everyone, is hypoglycemia, that's the idea of like your blood sugar dropping rather than being elevated.
Correct. So yeah. So there's a range that just for anybody, it doesn't matter if you're a diabetic, you're child or an adult, there's a range that you typically want to keep your blood sugar. And that range is anywhere from 70 to 140. It will vary a little bit on the higher side if you're diabetic, but the goal would be to have your blood sugar within that range. If you drop below 70, you're most likely going to start experiencing signs like what I just mentioned: brain fog, you're going to feel shaky, tired, hungry. Yeah. Those are signs of hypoglycemia. If you go above 180 or 200 or 250. These are very high numbers for blood glucose. And you're going to experience other signs that are a sign that you have a lot of glucose in your blood. And that would be feeling very thirsty, very hungry, and having to run to the bathroom to pee a lot.
Interesting. Okay. Yeah, I mean, I definitely will say, because, you know, thankfully you've been able to hook me up with one, and I've been able to kind of run with it for a little bit now. And I will say it has been very insightful to kind of get to see how the different types of foods and lifestyle that I'm living and how it is like affecting my blood sugar levels. You know, thankfully I haven't had any like big, you know, hypoglycemic spikes, or drops, I should say, or, you know, I've had a few spikes, but I don't think I've had any that have, you know, gone above that, you know, like 180 to 200 mark. So we're doing good so far.
Yeah,
but,
that's good.
I will definitely say it also has like revealed a lot of like, it has revealed a lot of better life choices that I need to start making regarding my food.
Right, right.
So definitely some diet changes coming up in the future for me.
Well, you're not alone, even though I've been following kind of the diabetes my plate method now in my house and with my family, and helping my clients to really understand what that means. Every so often, depending on if I'm in a rush or I have to get somewhere, and I immediately go back to my old habits. And the moment I do, of course, I'm like, oh, wow, I don't really feel very good right now. And then I look down at my CGM and it's telling me that my blood sugar's low. And then I understand, okay, so when I'm feeling this way, I really should pay attention to what my body's saying, because I didn't take the time to give my body what it needed to have in order to maintain a stable blood sugar and have that energy for whatever course of time in my day. So that's where I've been able to connect the dots. But, you know, don't feel bad. There are a lot of people that are just trying to do the best they can. And having this information, though, I think is going to be a game changer for a lot of people.
I agree. I think it is an incredible thing that you can be able to have something like this and have it show you just around the clock time of how your body is handling the foods that you're eating. And it'll give you a great indication of like, cool, if somebody is feeling very lethargic, they can, you know, look and get, okay, what have I had recently? What have I done recently? What is causing this feeling?
Exactly.
Kind of going off of that. So then I know that we talked about it takes it from a different portion. It's not just coming from the blood, it's coming from the interstitial. So how accurate would you say it is compared to like the blood? So it does it 24/7.
Yeah.
How accurate would you say it is compared to like that immediate kind of pinprick?
Right. So great question. I think that's a hot topic right now in the CGM world, just from kind of what I've been looking into and reading. Some devices I would say are more accurate than others. Currently, right now, I'm actually wearing a Dexcom G7 and a Libre 3 Plus, and ironically, they all fall within that certain range of being very close to one another.
Okay.
What I mean very close, like if the Libre 3 Plus is saying that I'm 140, the Dexcom may be saying that I'm 125. So
Gotcha.
They're very close in range, which tell me that for the metrics that they are supposed to be following per the FDA to make sure they're accurate, they're right within that range. Okay. Unfortunately, though, when you're comparing it to a finger stick to a CGM, you are probably going to see a wider gap. And that's just because the lag time that we talked about. So the time that it takes the glucose to get from the bloodstream into the interstitial fluid can take up to about 20 extra minutes. So what you might be seeing when you poke your finger is saying that you're 100, but depending on if you've just eaten something or if you've been active or maybe you're feeling something, your CGM may not read that same number for about another 20 minutes or so. Gotcha. So that's really important to understand. And I think that that's a huge misconception out there right now with a lot of people, is not understanding that there will be lag time, and that's normal. I think another thing that's key to take away is more or less just understanding that the data provides trends. So if you're not certain that your blood sugar is really 120 and you don't see that you have a steady arrow across showing on your CGM, and you have an up or down arrow, you have to understand that something's taking place in your body right now.
Yeah.
And that glucose is moving between the bloodstream into the cells, and that process is occurring. So if you don't see a steady horizontal line, there is activity taking place, and you should be, I would say, cautious, right, of whatever your CGM is saying, because it's going to take time for it to reflect whatever your finger stick reading is telling you.
Interesting. Okay.
Yeah.
That's good to know. So then, are there any, like, have you noticed any, like, foods or certain, like, medical conditions that will throw off that, like, differential at all, or is it usually pretty consistent throughout?
I can't say that I've noticed any medical conditions, but I have noticed in myself and with people who are experiencing reactive hypoglycemia, this tendency to where, and what that means is basically you've had a lot of sugar or something that, like coffee, for example. The way coffee is processed within the body, it sends an adrenaline boost to your system, and it creates your blood sugar to go up. Well, just as soon as your blood sugar goes up, it immediately drops right after that. And when that happens, if you're drinking that on an empty stomach, you will have what's called reactive hypoglycemia. So that feeling that you're getting when you're walking into the office after your first cup of coffee in the morning, and maybe you didn't have a chance to eat and you're feeling that brain fog, or maybe you're feeling hungry, or maybe a little dizzy.
Yeah.
Those are all those signs that, oh shoot, like I should have done something different in my morning routine. And to prevent this, I should incorporate more protein into my morning, or make sure it's a more well-balanced meal with the concept of the proteins, the fats, and the carbs, as well as fiber. Adding fiber in is key. So if you make those changes in your lifestyle, you won't experience that hypoglycemia the way that I've noticed it happening with myself and others. And what's interesting, and why that relates to your question, is because the other day this happened to me, and my CGM was telling me that my blood sugar was at 91, which is actually not textbook low, but I felt low.
Yeah.
And I knew that I was low.
Interesting.
And if I would have had a opportunity to check my finger stick, I'm sure that it probably would have corresponded with how I was feeling. And the solution is to eat something. That's what you do. You need to eat a carb, at least 15 carbohydrates, to bring your blood sugar back up. And as soon as you do, that feeling goes away. However, you have to be careful that if you keep that trend going, it could be a roller coaster all day long. That's why it's so important to understand that first meal and how to balance it out to prevent that hypoglycemia happening in the first place.
Totally. And I will say it has been a fun little trial that we've been going through of finding ways to kind of work on not having it be a roller coaster.
Yeah.
And I think the one thing that you had brought up to me, which was interesting, was just the idea of having like your protein before the carbs. And I think that's just a good life lesson for just a lot of people in general, because one, the protein will just be more filling. And so after eating that, you won't always even want as much of the carbs or the fats, but also it just helps with kind of leveling out the blood sugar. So the protein just helps to kind of make it so it doesn't spike quite as high, and then it just keeps it level. You don't have as big of a drop.
And the whole point behind that is it slows down the digestion of the carbohydrates. So when you eat it in that order, protein and then carbs, that's why you're seeing on the graph that it's leveling out the spike in the blood sugar. It's not as drastic. So yeah, it's fascinating to see how those changes, like what you are making, the impact that it has on your blood sugar.
Yeah. So then I would a follow-up question. Fiber, is that something that you've noticed have a very similar trend as protein, in the sense of, since our bodies don't naturally digest fiber very well and it kind of slows that digestion process, does that have that similar effect as the protein?
Yeah.
Okay.
Yeah, exactly. You're right on the money with that. It's the same kind of effect as protein. And as well as healthy fats. I think we have this tendency in, our culture and our population, like avoid fat as much as possible. But And that's what we were told. However, there is a certain amount that is considered to be healthy. So that's why it's so important to balance out that protein and fiber like we've been talking about, but not to forget about those fats, because it also works in the same way that protein and fiber do. And instead of your blood sugar spiking from just eating what we'll call naked carbs and nothing else, when you eat with the protein and the healthy fats and the fibers, it just helps lessen that curve.
Yeah, I agree. And it's funny that you bring up that we were told to avoid fats, because I hear it honestly both ways as well. I hear so many people are like, oh, we shouldn't eat fat, like we got to stay away from that. But then I also hear like the other side of this other group that was huge in like the Atkins diet or the keto diet. I think it was, not the Atkins, but it was like, we just have to avoid carbs altogether and don't eat any carbs. And there's so many of these like trends going around all the time, when the reality is like, there's carbs are great for you, fats are great for you, so is protein. It's just a matter of finding that balanced diet and finding, not even balanced diet, just balanced, nutrition is what I would call it, and finding a way to have it help you rather than be a hindrance.
Right. And that's the one thing I really love about the CGM is from a blood sugar perspective, in terms of how your body is using energy. You can see in real time how well you're balancing your meals.
Yeah.
Right. It will make it so clear to you. It's like, wow, I probably should have had some more protein, or maybe I should have had some more vegetables, or maybe I should have considered the idea of, an avocado, which is considered a healthy fat in my meal, right? As opposed to just going straight to making pasta and being like, well, I don't really feel good after I eat it, but I don't know why. Well, you'll see exactly the trend on the CGM.
You get a really big spike and a really big crash.
Yeah. And it helps you to see how to balance your meals better and the effects it has overall on how you're feeling.
Yeah. No, that is so true. I remember I think it was this past weekend. We had made some fettuccine Alfredo, and it was delicious. It was so good. But I looked within 20-30 minutes. I saw the spike happening, and it was a massive spike. It was one of the bigger ones that I had seen, and then it just had a huge drop off, and I felt it too. I was like, oh, I'm so tired. Yeah, because you feel so full, and it's just and you just are like, okay, this is what they call your carb crash, your sugar crash.
Yeah, exactly.
But then the following day I made some steak, and I had them both together and everything. Obviously I had the steak first a little bit, and I still felt it a little bit, because I'll be honest, I had a lot of the pasta, but it wasn't nearly as bad as it was that previous time.
Well, good. That's the idea, right? Making subtle changes here and there and improvements along the way, and to see that it didn't completely eliminate the problem, but you did see a difference. Yeah. That's the key.
Totally. Yeah, it really is a very fascinating device, and the amount that you can learn from it is really incredible.
Yeah.
So, my follow-up question would be just, how much have you seen stress, poor sleep, or even exercise impact what we see on the CGMs? Are there any patterns that will either surprise you or your clients?
That's another great question. So the one that I think the most that I've seen would be stress hormone cortisol. I think just because of the way that we live, that fast pace, gotta go.
Yeah.
Trying to provide for our families and keep up with the all the things going on. Most of us have pretty high cortisol levels. Yeah. There is a lab test that you can get to determine if that could be the potential cause for why your blood sugar is elevated. But if you have elevated cortisol, it will bring your fasting glucose levels up. So what is a fasting glucose? That's the glucose level that you look at first thing in the morning on your CGM before you've eaten anything, had anything to drink. And the goal is to have that below 100 milligrams per decibel.
Yeah.
Anything over that tells you that your body probably is not working quite as well. There's something, potentially you have some insulin resistance going on. Your body's less sensitive to the insulin that it's making. And the reason why your fasting glucose levels are high is because you have so much extra glucose in the blood that you don't need to have there. And it's in the blood because it's not making its way to the cells.
Gotcha.
And you can't use it for energy. So I would say the cortisol would be one of the number one hormones that I'm seeing a reason for people having elevated glucose levels. And that's not even related to diet or
Yeah.
exercise in general.
It's just
That's
gonna make
just
it that
from
much.
stress.
Yeah, that's just gonna make it worse.
Right. So if you have a high stress job, there you go.
Yeah, and you're not eating right, you're just a recipe for disaster.
Right. You see it. There's just the kind of like a kick the can down the road. There's multiple issues at hand. It's the stress, it's the nutrition, it's the lack of exercise, and then you have this like trio of issues, right, that you're not really able to deal with because of your lifestyle, and it gets out of hand very quickly. As far as other like sleep, I have noticed with patients that tend to drink before they go to bed that it does cause some sleep disturbances through the night, and you can actually see those trends on their CGM. Usually it will cause a delayed spike in blood sugar.
Okay.
So when you first drink, what ends up happening is your liver immediately goes to the alcohol to detox it out of your body. But while that's taking place, your liver can't release any glucose to manage your blood sugar levels. And as a result, you'll see those spikes happening later in the night. And then after your blood sugar starts to come down from the insulin that your body's released, you might have released too much insulin, and now you're dipping into hypoglycemic events. And these are all interruptions in the sleep patterns that are taking place at night. Okay. That's why when you're sleeping, the more steady you are, the better. And having a lower glucose is going to promote a better night's sleep.
Gotcha.
Yeah.
Okay, so having the lower like blood sugar levels is what you're saying helps with having a better night's sleep.
Correct. And you don't want them to be up and down all night. And if you're snacking before bedtime, having high carbs, drinking, things of that nature, it will influence your whole night and how you sleep. And believe it or not, most nights that you're having the roller coaster while you're trying to sleep directly correlates to whatever your blood glucose is doing.
That's good to know. I mean, I've definitely heard like how stress affects your sleep, and it's interesting to hear how, because I mean, obviously, if you are stressed out, like we talked about, your cortisol levels are going to be high, and that's going to affect, your deep, your REM sleep, and the ratio of your sleep cycle. And if you're eating before bed, obviously, like your body is trying to digest all that food while you're trying to sleep, and so it's going to be poor quality, and you're going to wake up and have your blood sugar levels all messed up as well. So, I mean, that makes a lot of sense how they all kind of just work together like that. It's almost like our body's a unit or something.
Yeah. Can you imagine, right? We're actually like a whole body instead of just separate little parts.
Crazy. Awesome. Well, I appreciate you sharing that. So then I have one final question for you, and I want to kind of wrap things up a little bit here, but if you had to give kind of just one big like takeaway about, diabetes, blood sugar health, to everyone, whether we're diabetic or not, because even if they're not diabetic, like there's bodybuilders who will use these things to try and track their sugar levels to make sure that they're in optimal condition. What would you say would be just one tip for people as a blood sugar health thing? What could people look out for?
Yeah, well, geez, there's just so many things that come to mind, but one I think in particular is I just really want to bring awareness to diabetes in general. First off, like we kind of talked about at the beginning of our session, there's such a stigma around diabetes itself, and I really would love to create a community where people are not felt made to feel like shame for where they're at in their health journey. Years ago, I myself had a diagnosis, and I have psoriatic arthritis, which is an autoimmune disease, and I wasn't made to feel that way, but it definitely felt like I was alone on the journey. And the message that I would love to share today is whether or not you're dealing with diabetes, whether it's prediabetes, type 2, type 1, or maybe gestational diabetes, here we want to create a place where you can come and get more information so that you don't feel alone in your journey, and then you can feel comfortable talking to other people about it without feeling embarrassed about having diabetes. And I think just to, as a kind of a wow factor, I'll throw in there at the end of the discussion, believe it or not, there are a lot of athletes who are struggling with elevated A1Cs. And the reason for that is because of their types of workouts. They are continuously getting their heart rates elevated, and their intensity and their workout style actually causes their blood sugar to go up. And it's the body's response to needing more energy to keep up with the demands of those workouts.
Yeah.
So as you can see, there's some misconceptions and misunderstandings about, A1C, someone that could be extremely fit but does, high intensity training 5 days a week, probably is going to have an elevated A1C. So if we can just bring more awareness and understanding and education around blood sugar in general, I think we're going to be just so much better in the long run for the people in our community.
Yeah, I love that. And I think that's a very good point too. And it's funny you brought up the idea of just doing like high intensity training like that so often, is because a lot of things that one thing that I've just noticed in like the fitness industry is a lot of people who are getting into it, they'll do all these like HIIT training. So like the high intensity interval training, they'll do it, 4 or 5 days a week, because, the harder you work, the more fat you're going to burn. That's kind of the stigma that has gone around. But in the reality is that's not necessarily true. That's actually kind of the opposite. A lot of times when you're doing very high intensity, like you mentioned, it kind of spikes your blood sugar levels. Well, what's happening is because of that, it's also, you're not burning a lot of fat in those situations. You actually tend to be burning a lot more muscle, because muscle kind of stores a lot of that glucose, especially when you're working out. And so that's where your body's like, okay, hold on, where are we going to get all this from?
Right.
And your muscle is a great storage unit for it. And so it's going to start taking away a lot from there. And so you tend to lose more muscle than you do fat when you do so much high intensity training so consistently. So it's usually only recommended like, around 2 times per week. Like I would say anywhere from 1 to 3 times per week at most for like those super high intensity trainings. Other than that, keep it, a little bit more lower, steady state type of cardio is fantastic. But yeah, with it spiking your blood sugar levels, that's really good to know.
Yeah, and the CGMs will provide that insight to anybody who is doing that type of training and want to have a better understanding of what's actually going on in their body.
Yeah.
And it can actually help you fine tune your exercise workouts.
Which is fantastic, because I doubt there's a single person who probably wants to pull out like a little strip and just poke their finger mid-workout. That probably
nobody. And those hurt. Those really, really hurt. A CGM doesn't hurt to apply.
Yeah,
so,
not at all.
If I had to choose between the two, it's definitely going to be a CGM over a finger stick. That's for sure.
I would definitely agree with you on that. Awesome. Well, thank you so much for coming out and giving me some of your time. I really appreciate it. And I definitely will be coming to you if I have any more questions on, glucose monitors or anything having to relate to blood sugar levels.
Awesome. Thanks so much, Jack. I appreciate it.
Yeah, of course. Sweet.